Once again, thanks everyone for joining our first webinar from the new series about skin active longevity, which we start now on 17th of August and which will continue until mid-May of 2027. Yes, it is how positive we are, and that's how we see the future. Then active skin longevity will be incredibly important topic in the upcoming months, despite everything happening in the world. You will participate in 10 sessions. All of them will be free to access. And I really hope that for every one of you, our colleagues, beauticians, aesthetic doctors, other skin practitioners, and simply skin intellectuals who are looking for objective information about the skincare, it would be useful and interesting at the same time. If you want to get more information about our educational program, you can find it on our website, mederbeauty.com. In the menu, you just pick Meder Education, and you will see the full education program and everything you need about this program. And we will put the video of webinars later, YouTube link on this page. And please follow me on socials, Dr. Tiina Meder, Instagram, LinkedIn, and follow our podcast, Meder Beauty, the skin we live in, which, surprise, we are planning to start the new season next week. And this new season will be all about skincare ingredients. So let's open the door to the future of the skincare. And once again, thank you so much for joining the webinar. It means a lot to me. As I mentioned, the webinar is free to access to everyone, but we do it to support amazing Ukrainian charity, which calls City of Goodness or Mr. Dobra. It is a special shelter located in the relatively safe space in the west of Ukraine, in the beautiful city called Chernivtsi. And they are housing and help hospitals, medical support for women, children, elderly people, and homeless animals who suffer from the war and domestic violence. They do incredible work and they really need our help. And the City of Good now is registered as charitable organization in the United States of America. So everyone who is located in the States, you could donate through the CAF America platform. What we'll do today? Today's roadmap will include the explanation about active longevity as skincare strategy, all traditional skin types diagnostic after I switched to the skin types diagnostic by Leslie Bauman. And we will go through different assessment, dryness and oiliness assessment, acne assessment, skin sensitivity assessment, redness, wrinkles, pigmentations. And to end the webinar, I will guide you through our Meder biofacials, and I will explain how to choose Meder biofacials based on our Meder 7 steps objective diagnostic algorithm. Obviously, if you are skin practitioner, skin professionals who doesn't work with Meder yet, I hope one day you will try it, you could use all this information to choose your facials, professional treatments, which you use in your practice. If you are skin intellectual who doesn't work professionally, anyway, it will be very useful for you because you will understand much better what you need and most importantly, what you doesn't. And to finish our presentation, I will present you our Meder Skin Needs Pyramid, the Maslow pyramid for your skin. I know it sounds like a lot, but I will try to keep our timing 40-45 minutes, and we will get 15 minutes for your question, and I will try to answer them all. So let's start from skin active longevity. What it is? It is science-based strategy to keep skin functioning. So skin active longevity, it's all about skin function. It's not about how the skin looks. So we are very much focusing to keep skin functioning in the useful, healthy way for as long as it's possible. And it is a big difference because for many years we've been speaking about prolonging life. Now we are speaking about the prolongation of the life quality, because honestly, what's the point to live longer if we are miserable? Our target is to live long and happy as long as we can, and skin, being the largest human organ, contributes a lot to our health. So if you care about your skin active longevity, you care about your body active longevity. How we do it? We support all key cellular processes: energy production, repair, cellular detoxification, the detox of the extracellular matrix. We support as much as we can, and as far as we know, microbiome balance, and we support communication between cells, because cells, they are chatty. They communicate between each other all the time. And this communication is the foundation for the skin health and for the skin function. So age-related changes appear later. And at just one point, please check your microphones and your video if you can switch it off, so it would be easier for everyone. So, and a few words about how active longevity is different from the anti-aging strategy. Anti-aging strategy was the most popular during all these years, and probably since end of 80s, beginning of 90s, the anti-aging strategy been developing in the aesthetic medicine and the cosmetology and all around the beauty industry. What is anti-aging, which we loved so much for so many years? It is a strategy which fights signs of aging, wrinkles, sagging, pigmentations, and so on. And it's very much focused on the covering damage to look younger. And it's all about fixes, and I dare to say about quick fixes, especially now in the last 15, 20 years, when we have an open access to injectables and lasers and all this amazing technology. One of the priority is to transform your skin as fast as we can. People really are looking for the solution, so they enter the room and they leave the room without wrinkles. So aging is seen as, we can say, an enemy, so we fight it or we hide all presence of aging in our body. Active longevity is different from the anti-aging, but it doesn't exclude anti-aging strategy. Actually, it's really good to combine with, but for me, an active longevity, it is a foundation. With all support of the skin functions, with all support of cell function and the microbiome balance, as far as we know it, based on the latest science research, we can help the skin function younger, function longer, function better, and achieve the long-term resilience. And obviously, healthy skin always looks better and always looks younger. So active longevity is kind of partnering with your future self. When we support active longevity, when we use different types of technology, skincare products, different ingredients, when we transform our lifestyle for better, we are thinking about ourselves, but in distance. How we'll feel in 10 years and 15 years. So it's all about gratitude. If your skin will thank you in 10 years for this procedure or treatment which you perform today or not. But with an active longevity, once you switch to this trajectory of the active longevity on your skin, and one day you can see your wrinkles and you can think, I'm unhappy about it. You can make it correction, but if you are using the corrective methods for wrinkles or pigmentations or something else on the basis of active longevity, it would be much safer. Results will prolong much longer, and it would look much more natural. So, all starts with diagnostics. In the upcoming 10 webinars until the next spring, we will speak a lot about different skin problems, different aesthetic directions which we can use for the skin treatments. But we start with the diagnostic, because without a right diagnosis, we are absolutely blind. We cannot do anything. But it is tricky, right? Because in the diagnostic, all we have more or less internationally what our beauticians and skin practitioners, they've been taught in the beauty schools. It's all about traditional skin typing. So classic, 4 skin types: normal, dry, oily skin, sometimes sensitive skin types. You can find 5 skin types like dry, oily, normal, combination, sensitive. And it is kind of very primitive. Even astrology is more complicated. We have 12 types in astrology. We have all the zodiac signs. But with 4 or 5 skin types, we are trying to get 8 billion of people split it in 4, max 5 groups. Obviously, if we speak about the skin personal types scientifically, it's much more complicated. So what types of classification we recommend to use for the skin diagnostic? Since 2005, when first the skin type classification was published by Dr. Leslie Bauman, who is practicing in the Miami University in the USA, and she is an amazing dermatologist and specialist in the skin typing and in the skincare. And she offered these 16 skin types diagnostic in 2005. And I found it extremely useful. Easy to use in the daily practice. Very easy and practical to follow the dynamics of skincare and all types of treatments results. And it is really understandable, it's clear for everyone. So since 2005, I'm speaking about this Dr. Leslie Bauman's diagnostic everywhere, and I hope that I just probably transformed the view of few thousands of beauticians around the world. We are practicing in more than 30 countries over the world, so I am sure that I've been informing as much as I can about this skin classification. All beauticians who took part in our webinar, seminar, and workshops. But it's never enough. And unfortunately, I can say that this skin types classification, it's not popular as it should be. So how we use this classification? We have 4 different questions which we should ask to classify the skin type by Bauman. And first question, it's about skin dryness and oiliness. Second question, it's about skin sensitivity. Third question, pigmentation. And fourth question, wrinkles. To create the skin types, we are using abbreviator. For abbreviator, we're using letters which are coding all skin types. D for dry, O for oily, S for sensitive, R for resistant, P for pigmented, N non-pigmented, W wrinkled, and T tight. And different combination of these letters create 16 skin types. Why it is so important? Because from the first point of view, once you're familiarized with this classification, you could see how healthy the skin is. When you see letters R, N, and T, they are always good signs. Because when the skin is resistant, non-pigmented, and tight, it means the skin is more or less healthy because it functions so well. So the pigmentation is under control. The skin sensitivity is not increased, and wrinkles are not developed. So elasticity is on the good level. So our fibroblasts, cells in the deep skin layers, they are working actively. Letters D or O, dry or oily, are not speaking about the skin health. They're speaking about our genetic predisposition, because having a skin with a tendency for the dryness or having a skin with a tendency for the oiliness, both types are absolutely healthy. When you see one of the tricky letters like S sensitive or P pigmented or W wrinkled in your skin types, you see your target. For letter S, we should work on the skin sensitivity. We should calm down immune system of the skin. We should restore the skin barrier. If we see the letter P, we understand the pigment cells of our skin are contributing to the excessive synthesis of the pigment or in the deficiency of the pigment. And when we see the letter W, the skin is wrinkled, so we have a problem with the skin elasticity. Very probably our skin has less of collagen than we want it to be. And it can be age-related signs, that skin can be sun damaged or air pollution damaged, or this person can live under the higher level of stress, and so on. So once you see the letter, you see your focus. The problems with this diagnostic, it is objectivity. And when we are speaking about the skin diagnostic, many beauticians, they are saying that how can I perform this diagnostic and the consultation if I don't have all these expensive instruments? Because we are so used to think about the diagnostic as something very much related to the technology, then we forgot a little bit that we have eyes and we have hands and we can diagnose the skin and we can diagnose medical condition basically with our observation and discussing with patients about the skin, at least about the skin. When I graduated from the university in 95th, I am from this generation of medical doctors who been trained to diagnose appendicitis without ultrasound. And we've been trained to find pneumonia without radiology X-ray exam. And it is possible, and it's absolutely possible to diagnose skin dryness or oiliness without sebometer. If you have sebometer, that's amazing. But if you don't, you're still able to do it. It is possible to evaluate skin pigmentation. It is possible to evaluate objectively wrinkles. So let's see how we do it. We have 7 steps here. First step, it is an assessment for dryness and oiliness. First of all, we should understand which type of the skin we have here. Dryness or oiliness, it is a genetic predisposition based on the sebum glands function. If your sebum glands are genetically predisposed to the deficient lipid synthesis, your skin will have a tendency for the dryness. So under the stress and with an age, it would be drier and you will experience some discomfort. If your sebum glands are genetically slightly overactive, your skin will be oilier. And you will be in the group of people who will enjoy of the better skin hydration, but you will be in the high risk of the acne development or pores enlargement. But for the right skin diagnostic, it is not enough just to say dry or oily. We should scale the level of dryness or oiliness on the first consultation. We have 4 grades of dryness and oiliness. So let's go through them. It is not complicated at all. For the skin dryness, when it is mild, we say this first grade, you will feel occasional tightness or very slight roughness without any flaking, and very probably it will develop when you are experiencing some stress. For example, you are traveling long distance in the flight when the air is very dry, or you will experience this skin dryness when you didn't sleep well, or seasons are changing. So when you just go from the winter to the summer. If the dryness is second grade, moderate, this tightness can be more persistent and you will feel like you really need to apply moisturizer. People with a moderate skin dryness feels very uncomfortable without applying skin moisturizer, so they care about their skin religiously since the early 20s. They are people who are using moisturizers day and night. On the third grade of the skin dryness, we call it marked. So roughness and tightness will be more noticeable, and you'll experience diffuse flaking and very probably reduced elasticity and some itching, sensitivity, redness, because with marked dryness, the skin barrier function is always disturbed. Why it is important? Because on the third grade of the dryness, it's very difficult to compensate it with traditional skincare. You should use professional skincare here. And in this case, we should go for the professional treatments and for the most intense care for the skin. And finally, step 4 of skin dryness, severe skin dryness. Most of these people, they are dermatology patients. A high percentage of this group of the people, they are suffering from different types of dermatosis. When the flaking is widespread, the roughness is marked, and we always see inflammations and fissures here. So when you see severe skin dryness, which cannot be compensated with skincare, or any types of cosmetic treatment, we should think about dermatology consultations in the first place. About the oiliness, once again, mild oiliness, everything is fine. Skin will be slightly shine, mainly in the T-zone, and the time of the shyness, it's very important as well, because circadian rhythm of the sebum glands activity leads to the higher sebum glands activity during the midday. Your sebum glands are most active from approximately 11:30 a.m. until 2:30, 3 p.m. It is protective function of the skin. Your sebum glands try to protect you from the water evaporation and to improve the skin barrier with lipids as much as they can. Some people, they think if your T-zone is shining in the midday, it means that you should mattify it. We should use special product for better control of the skin oiliness. I am not agree with that because it's absolutely healthy. Leave your skin, protect you, don't disturb it. Yes, pores may be slightly visible, but as far as they're clean and not inflamed, everything is fine. Moderate skin oiliness, second grade, you see the shine develops earlier. If your shine develops at 10 a.m., it is a sign that you go for moderate skin oiliness, and it may affect not only T-zone, but most of the face, and pores will be clearly visible. In the marked skin oiliness, we are coming to the persistent shine, and here we are speaking about the necessity of the professional control and probably professional treatments. Because when your skin is producing sebum, not circadianly, but during the whole day, if you patient, if yourself, you are waking up with a shiny face and the sense of discomfort, like you feel you need to clean up your skin, then your sebum gland's activity is out of control, it can lead to enlargement of pores, development of comedones, and inflammatory breakout. So simply speaking, acne. And finally, severe oiliness, most of the cases is combined with different grades of acne, and it contributes to the acne development a lot. So in the acne treatment, I will speak about acne treatment and oily skin a lot in one of our webinar. So we have different types of treatment, but also once again, grade 4 needs of dermatology assessment. It can be acne, it can be seborrheic dermatitis, it can be something else. After you diagnosed dryness or oiliness and put your grade in your client's patient's card, if the skin is oily and we are speaking about third and fourth grade, we need to evaluate the acne. For the acne evaluation, I recommend to follow the official guidelines using the investigator's global assessment. Visual clinician rate is grade from 0 to 4. 0, no active acne lesion. First step, almost clear. So we see rare comedones, like under 5, or very small papers. Second stage, mild acne, probably 10 till 15 comedones and few papules or pustules. In moderate acne, we see many comedones, 15 plus and more, and inflammatory lesion, maybe 1 or 2 small nodules. And finally, very severe acne, full face or nodular form of acne, numerous inflammatory lesions, and nodules are almost always present. Why it is important? Because it is not enough just to take a photo. You should assess acne severity, and you should go through this assessment at least once every 8 weeks. 8 weeks, it is a timeline of the comedone development. So when you assess the skin properly, you will see what is the dynamic of your treatment. If in 8 weeks' time, you didn't ameliorate the situation, if you diagnose in the first consultation moderate acne and 8 weeks later you're still in moderate acne, you should change the strategy. So it's all about it. It's all about dynamic. And second big question, it is a sensitivity score. And for me, it's kind of Shakespearean question, sensitive or resistant. That is a question to be or not to be. Why? Because sensitivity is highly subjective. Even histologically, you don't see any significant changes in all skin layers, including stratum corneum and superficial layer epidermis. Skin barrier can be intact, but skin can be sensitive anyway. I will speak about skin sensitivity in October in our third webinar, but the diagnostic and sensitivity score is extremely important. How we do it? As far as the sensitivity diagnostic is difficult, we have a few tests, like tests with obligatory irritants like lactic acid. Recently, retinyl palmitate started to use as an obligatory irritant in the skin irritation tests. But we have the special scale created by Professor Laurent Misery. I am the biggest fan of Professor Misery from France. He is the biggest authority in the skin sensitivity and skin microbiome, sensitive skin microbiome, as many other areas. And it is absolutely objective, patient-reported sensitivity assessment used by dermatologists, which also gives you free access to the evaluation of the sensitivity dynamic. How you do it? There are 10 simple questions. You should ask your client, your patient, yourself to rate each of 10 following symptoms over the last 3 days. Time frame is very important, because if you ask someone, did you experience the skin irritability, without putting it in the time frame, obviously everyone experienced it. at least once in their life. So please don't forget about this 3 days thing. So we ask 10 questions, and we ask to rate each symptoms from 0 to 10. 0, it's nothing at all. I didn't notice this symptom during the last 3 days. And 10, yes, I noticed it was absolutely unbearable. I couldn't sleep. It was painful. It was highly uncomfortable, and so on. So we rate each symptoms: irritability, stinging, burning, heat sensation, tightness, itching, pain, skin discomfort, flushing, and redness. And we calculate the score, adding all 10 ratings. If you have numbers lower than 20, congratulations, the skin is resilient. Your hands are free. You can do whatever you want. Speaking about different types of aesthetic treatment, you can use active skincare if you wanted. I still don't see the point to use aggressive skincare, but at least with resilient skin, when sensitive skin scale is less than 20, you are in safe place. If the numbers are from 20 to 40, the skin is mildly sensitive, so you should be careful, especially using acids, especially recommended prescribing retinol-based product, and you should be careful with the choice of aesthetic treatments and professional treatments. If the numbers are from 40 to 60, the skin is moderately sensitive, and it means then if you try to use something even slightly aggressive, it will explode in redness, in flushing, in high discomfort, in burning pain, and whatever you want. Give it 3 days, and you will give text and calls from your patients who will be highly unhappy. If the grade is 60 plus, the skin is highly sensitive, and very probably behind it is hidden dermatosis, or not so hidden dermatosis, or maybe some autoimmunity disease. So when the grade is 60 plus, that's an indication for the medical consultation with dermatologist or general practitioner. So you should use a scale. It's called SS10 scale to structure discussion with your patient and to track symptom change. I recommend to evaluate the skin, if it is possible, once in every 5-6 weeks to see where we are and how we can personalize skincare strategy. Question 3, wrinkles. We know about skin types. We know that dry skin develop more wrinkles, so it would not be surprised if you diagnosed someone with a dryness 3 and redness and sensitivity to see some wrinkles. But also wrinkles can develop on the perfectly healthy skin. It is an age-related science. We have different types of wrinkles, and also, once again, we will get a specific workshop webinar about wrinkles. But Merz wrinkle scale, it is an incredible consultation tool for all skin practitioners, beautician included. It is very easy. You observe face at rest, you observe face in dynamic, asking people to show different types of face expression, to be a little bit artistic, or just observe the face during your conversation, during your discussion. And stage 0, we see no wrinkles. Stage 1, mild wrinkles, which you see at dynamic and you don't see at rest. Stage 2, moderate wrinkles, which you can see when people are emotional, and you will see superficial wrinkles, light signs. At rest, they will be there. Severe wrinkles, they look more or less similar in conversation and emotional states or at rest. And very severe wrinkles, they are lines in the furrow, which are deep, long, and don't change at all in the conversation or emotions. To evaluate wrinkles, to evaluate dynamics of your skincare and treatments, it's better to use the same lightening, same angle, and facial expression. Also here, standardized photo, it is a very useful tool. So you could record grade and you could record photo. So you could use all together. Merit scale, it's not a picture, they are photo and generated photography. In Merit wrinkles, you have a specific atlas, so educational aid. You can find it online. I just put it on the few slides to show you how it looks. We can evaluate all types of wrinkles. We can evaluate face sagging. We can evaluate neck, lips volume, eye area with Merz scale. That's a huge tool. And it's very easy to find. So you just Google or ask ChatGPT about Merz scale and you will get all imagery. So forehead, eyes, glabella, nasolabial folds, marionette lines, eye area, the principle is the same. So you can find all types of wrinkles here. Jawline, sagging face, everything you need. And when you evaluate it, you add photo of your patient and you evaluate all zones of the face with the severity of wrinkles by Merz. And finally, we come to the most complicated evaluation, the pigmentation evaluation. Why it is so? Because for the pigmentation, we use following official guideline, we use the scale called Melasma Area and Severity Index, MASI. It is a clinical tool to score how severe facial hyperpigmentation is. And actually, it is easy to use if you know how to calculate it. It is used in dermatological research. It is used in different types of research of efficiency of pigmentation treatment. And it shows you the severity and the characteristic of the change when you are treating pigmentation. What you should know before you calculate the MASI index. First of all, you should evaluate how much of the face is affected. It's called area. Second, you should evaluate how dark the pigmentation is. We call it darkness. And finally, how even the pigmentation looks. It's called homogeneity. So for area, we have 6 grades. First one, less than 10% of area is involved. Second one, up to 30%, and so on. Sixth one, the maximum 100% of area is involved. In the darkness, we start with normal skin color, 0. And after we go for barely visible hyperpigmentation, mild, moderate, severe. And for homogeneity, 0 is normal. 1, specks of involvement. Second, small patchy area. And for the last grade, that's uniform skin involvement without any clear area. What is important about the pigmentation assessment? It should be done by the same person. Why? Because the evaluation of the skin color can be different for different people. So it is kind of subjectivity in the MASI scale, but also you have the photo evaluation here. So how we calculate it? Don't be afraid. It's not so awful. It looks awful. I know the formulation. No one loves math formulations. But you have area, you have darkness, you have homogeneity, and all you need to calculate all these parameters for face area, forehead, 30% of the face, one cheek, another cheek, and 10% for the chin. For each area, you evaluate each parameters, like rate area A from 0 to 6, darkness from 0 to 4, homogeneity from 0 to 4. And after you add darkness with homogeneity, multiply it on A area rate, and add the coefficient. Coefficient will be 0.3 for all area when we have 30%, and 0.1 for the chin because we have 10%. And you add this for numbers. It is a little bit of math, but you have calculators. And also, if you're using some AI tools, you could just evaluate which area and give the list to your ChatGPT or another AI. It will calculate MASI index for you. What are results? The scale is from 0 to 48. So from 0 to 12, it is a low pigmentation. If you ask me, no need of treatment. From 12 to 24, it is a medium-grade pigmentation, which should be relatively easy to treat. Most of the time, in this severity of the pigmentation, we can go with the skincare, home skincare. It will take from 8 until 16 weeks if you're using quality, efficient, medical-grade, professional-grade skincare products. If the pigmentation is from 24 to 36, I suggest to think about aesthetic treatments, and laser therapy. It is a gold standard for the pigmentation treatment. And obviously, when the severity of the pigmentation is high, we are using everything possible, and we discuss it with the patient, because when we speak about medium or high, very high level of the pigmentation, please don't promise the miracle. It will take time. Very probably it will take at least 6 months, and you should be very careful with the prevention. Once again, it would be a special webinar about the pigmentation. So you have these 7 scales of evaluation. So in the first consultation, we go through 7 steps. First, sebum function, dry, oily. If your skin is on the level 1, we call it balanced. We can even do not use the name dry or oily. If you go to number 2 or higher, dry or oily severity scale, we score it. In the case of the oily skin with a score 3 and 4, we go for acne evaluation. Obviously, acne will be there, promise. We evaluate sensitivity for everyone using SS10 scale. If the skin is sensitive and sensitivity, your grade is higher than 20 and very probably 40, we go for redness scale. Oh, sorry, I didn't show you redness scale. I will add it to our PDF tool. It is kind of easy scale. You just, it's very similar to the pigmentation scale, acne, to pigmentation MASI score. So it should not be difficult to do. And after redness, you go to wrinkle scale, and you finish with pigmentation score. And you create your personalized skin strategy, choice of the professional treatment, home care strategy, and follow-up reassessment based on what you see in your diagnostic. If your skin is sensitive and the sensitivity is 20 or higher, or 40 or higher, you go for CAT redness score. It's a clinical framework for evaluation of telangiectatic form of rosacea. So how we evaluate it? We evaluate the area of the redness. We evaluate the extent of the involvement, so how much of face is involved. And finally, if you see the telangiectasia, the cuperosis. So when it is intense, you just evaluate each part with numbers, and you add these numbers, and you will get this in your PDF tools after the presentation. So you can evaluate redness as well. So once again, 7 steps. Step 3, acne score. And step 5, redness score, they are additional. So acne score, you are using only when the skin is oily and you see inflammation. And CAT score, redness score, you use only when the sensitivity is higher. For resistant skin or mildly sensitive skin, no need to use CAT. And this skin diagnostic algorithm you can use to choose the right treatment for your patients. If you're working with Meder, if you are using Meder biofacials, these tools are absolutely invaluable to pick up the right treatment. Why we call our professional treatments biofacials? Because we are trying to use bioidentical skin ingredients and create the bioidentical skin treatments which can be easy to read for your skin and accept this as an action. We are using a lot of biological ingredients based on the latest research in the molecular biology, peptides, probiotics, prebiotics, growth factors. We are using biotechnology, and some of them, they're really interesting, like, for example, for an acne treatment, we are using plant stem cells cultured in the plasma rich of acne or Cutibacterium acnes bacteria. We are using biofermented metabiotics, and in the professional setting, we recommend to use biophysical treatment as well. You can use ultrasound, you can use biomechanical stimulation, microcurrent therapy, and light therapy. All of the biofacials, they're coming in ready-to-use sets. Each set contains everything you need to perform 5 treatments. We are using pharmaceutical standards, so everything is pre-dosed, everything is sterile. We use single-use packaging, so it's literally ready to use. It looks like a surgery kit. No medical director needed. It is still cosmetic products. The biofacial standard timing is 45 minutes. It can be longer if using some technology and biophysics. And we have different special clinics protocol, and they safe to use for pregnant and nursing women, because my principle, safety goes first. My way to the industry started as a cosmetic safety expert, cosmetovigilance expert in France, and I just believe then if something it's not safe enough to be applied on the skin of pregnant women, it's not safe. That's it. And it can be used for medical purposes, but not for aesthetic purposes. So what we have 6 different biofacials, 6 boxes. It's kind of the biofacials library for clinics or beauty salon. Myofix, it's peptides-based mimic wrinkles treatment. Lipo-Oval, it's a face contour treatment. Red Apax, it is a neurocosmetic rosacea and redness treatment. EUSEP, it's probiotic, prebiotic-based acne treatment and oily skin treatment. Armlift, pre-post menopausal treatment, and our main active longevity treatment for people with developed age-related signs. And finally, Hydrofill, our hydration glass skin treatment, one of the most universal treatment you can find. So how we pick it up? If your dryness scale is higher than 2 or 3, on the sensitivity scale, you have number higher than 20. Very probably you have higher number in CAT scale, and MERS and MASI scale also can be out of basis. You go for hydrofill treatment. Dry and dehydrated skin, indications are skin dryness, skin irritation, skin flakiness, uneven skin tone, signs of pigmentation, pigmentation disorders, and tired face. Easy. Thank you very much for all Meder experts, clinics, and team who sharing with us this amazing before and after results. Here you can see 5 weeks of the treatment. So apparently we have the significant improvement not only in the skin hydration, but also in the skin pigmentation at the same time. Oily skin and acne, EUSEP treatment, oiliness scale, 3 and 4, acne scale, And also sensitivity scale, because acne-prone oily skin can be very sensitive, can be red. And these people can experience post-acne pigmentation as well. So MASI scale is also important to evaluate the dynamic and the efficiency of the treatment. Indications: oily skin, enlarged pores, comedones, period acne, stress-related acne, hormonal acne, inflammatory acne vulgaris, classic. So all these types of pigmentation, we have specific biofascial called EU sep. EU, good in Greek, and sep is sebum, so it's all about good sebum. If you evaluated skin sensitivity for 40 and plus, and maybe 20 and plus, you definitely need our red Apax treatment. So here it is sensitivity scale and CAT scale. Simply speaking, persistent mild to moderate redness, persistent skin discomfort, higher skin sensitivity, but also menopause flushes, situational redness, and rosacea. You can perform this red Apax treatment even for rosacea patients, especially in the period of remission. Merz scale, 2+, when you see moderate or severe wrinkles, or you want to prevent wrinkles from the development at the early stage. Most of the time, we have this patient with skin more prone to dryness than to oiliness. It can be sensitive skin. Anyway, you can perform the MyoFix wrinkles treatment. And these people can experience the pigmentation as well. So once again, for evaluation, pigmentation scale can be useful. MyoFix, it is a specific biofacial. It was the very first product in 2009. That's how I launched the brand. Still very popular. It is a peptide-based mimic wrinkles treatment. Expression lines on the forehead, frown lines, glabella area between the eyebrows, crow's feet, and purse string clips. All of it, MyoFix. And once again, thanks a lot, Swiss team. That's how it looks after a few treatments of the MyoFix. Lipo oval, my personal favorite, because it's so rare. There are a lot of people who are suffering from the face puffiness, molar bags, double chin, skin sagging, even in the young age. And all of these people that have this tendency for the deformational aging of the face. And I created this lipo oval biofacial especially for these people to eliminate the excess of the heaviness in the face, to improve lymphatic drainage, and to target fat tissue as well. Yes, it is possible using some types of technology, helping ingredients to penetrate, and some specific ingredients. So here we evaluate the sagging and jawline by the Merz scale. Pigmentation scale can be useful as well, because anyway, all of our biofacials, they are interacting with pigment cells, they improving barrier function, so you will see positive dynamic. And speaking about indication, double chin, under eye bag, molar bags, deformed face, tired face, gravity lines. Thanks again for Swiss team. You can see it's one treatment before and after. You can achieve significant improvement if you diagnose the situation properly. And finally, Armolift, our main key biofacial for all age-related changes and for perimenopause and menopause period. So here we go through all assessment, because age-related changes never come alone. Like, you will never see wrinkles only in 65 years old face. So we go for dryness, oiliness scale, sensitivity scale, redness scale, Merz scale, MASI scale. And Armolift treatment helps to improve not only the skin quality, but also we are using this specific technology, helping to improve receptiveness for estrogens as well for menopausal women. So perimenopause, menopause, all types of age-related loss of elasticity, age-related sagging, wrinkles, except for mimic wrinkles, forehead and upper part of the face, mid part, low part of the face wrinkles. It's also arm lift, pigmentation disorders, as it is brightening for the face, and thyroid skin for mature skin. But even if you're using best quality skincare, even if you perform best biofacials and best treatment, please do not forget that skin active longevity has a foundation. Nothing can replace healthy lifestyle, healthy diet, healthy sleep. It is a foundation of active longevity for skin and for body. You cannot build the pyramid from the peak of the pyramid. You should start with the foundation. But when you build healthy foundation, skincare will be the next level. And when you build skincare routine, when you choose the right non-invasive topical treatments, you can use biophysical approach using different kind of technology. I always use like a next level, it's microcurrent and light therapy because they're absolutely bioidentical, they are not aggressive, and they really help to increase skin resources when used. After this, that would be energy-assisted treatment, injectables if needed, surgery, and God only knows what we will have in the future. But please don't forget that healthy foundation, it is a foundation for longevity, for active longevity, for our body and for our skin. And thank you so much for your attention. Once again, a few words about the brand, if you are not familiar with what we'll do. Meder by Dr. Tiina Meder, it is a skincare brand I created in 2009, so 17 years ago. We are working with clinics and salons in 34 countries over the world. I think that one of the benefits of our brand is created by female dermatologists with a full understanding of the changes in the female skin. It's microbiome friendly. We've been using probiotics since 2009. We manufacture everything in Switzerland, and we are specializing in innovative biotechnological approach to the skin. Thanks a lot. And now I will answer all your questions, which you leave in chat. If you have any question, please write in chat about it. And pre-announce, our next webinar will be about the choice of the daily care and the creation of daily skincare routine for active skin longevity. And we'll welcome you on 14th of September, same time. And here I am, very curious about our chat. Sorry, I cannot see all question for some reason. Just let me see. For some reason, everyone, now I see it. Okay, here I am. So first question, Daria, thank you very much. You have a question about skin sensitivity. We ask these symptoms to occur on the face, on the entire body. Great question. I prefer to ask about entire body. It's how it's recommended by Dr. Misery. But I can say that if your skin is sensitive, face will be the first area. Face and hand, open area will be the first to show the sensitivity. So even if your patients, if you forgot to say that it's about all body and your patient is responding only about the face, 95% of probabilities, and it would be all right. Natalia, where can you find these clinics, protocols, biofacials? You can find in all Meder clinics around the world. If you are looking for clinic when you can get Meder biofacial in your area, please contact our support info and tell us where you live, and we will find someone for you, specialist for you. Can Energy Net and Energy Swan serum be used for skin with the signs of sensitivity? And if yes, which grade? Just for someone who is not familiar with our Meder skincare range, we have cleansing and antioxidant serum called Energy, based on nice name and a lot of probiotics, antioxidants. They are designed for resilient skin. So great question. If the sensitivity grade is higher than 40, I recommend to use Net Apax and Swan Apax cleansing mask and serum for sensitive skin. If it is lower than 40, go for Energy. Between 20 and 40, you can be more individual. So if it is someone who is living in the period of stress, safe choice, go for Apax range. If the life is under control and you see then skin sensitivity is mild and not very much located in the face area, you can use Energy. The difference between lipo-oval and armor lift. Aging and sagging can occur in the same time, right? Lipo-oval, it is the best choice when you see puffiness, when you see the retention of liquid. So you wake up with the puffy face, your client, your patients wake up with a puffy face. You can see molar bags, you can see under eye bags. The face is heavy, so you feel like you should improve the microcirculation. You should eliminate this excessive volume. Age-related changes in sagging skin, if they are not related to this gravitational puffiness-related deformation, you go for armor lift. Lipo-oval can be used at any age. Armor lift is recommended to use for clients and patients in the group, I will say 40 plus, maybe 45 plus. Hope I answered your question. Oh, should we take into account the skin thickness? Valerie, thank you for this answer. Yes, but we cannot evaluate skin thickness without instruments. So if you have the technology which helps you to evaluate the skin thickness, the actually golden standard is ultrasound. So it can be expensive and not very affordable for all types of professionals. And also skin thickness is one of the parameters which should be seen in the combination with other parameters as well. Most of the time we see the skin thinning in the aging skin or in the severely damaged skin. First of all, the skin damaged by the ultraviolet. So when you see signs of the ultraviolet damage, like higher pigmentation score, higher dryness score, higher sensitivity, you can presume then skin thickness is decreased. Thank you, Tatiana. Happy to know that you loved our webinar. And once a month, you remember that once I mentioned that once a month we should spend a whole day without using any products on our face, and it can help us understand whether our beauty routine is actually right for our skin. And the question is, on that day, should we wash our face in the morning with just water, use a cleanser, or not do anything at all after waking up? Thank you for this question. I still think it's a great type of evaluation. And I always recommend to do it for everyone who has the established skincare routine for 6 months and more. So to know if you should change anything in your skincare routine, you should see how independent your skin is. If you can survive 24 hours without applying skin care products on your skin, it means then your skin has a compensation. Then deficiency are compensated. It is strong enough. Yes, very probably you should use the next day, you should restart to use your skincare, because we are living in such world, then it is difficult to leave the skin alone. But if you feel comfortable at least for one day, it is great. You're not obliged to do it once a month. I suggest then you do it probably first in the 6 months after you're using the skincare routine, and after probably once every 3 months, you just repeat it to see if you should add something or if you're still comfortable. And the cleanser, it's a product which I suggest to use in the morning and in the evening, and just you not apply any product later, and you see how your skin reacts. Obviously, if you have some dermatosis, if your skin is genetically very dry or oily, if your acne is not under control, or if something else is not under control, it will not be your best tool. But for the healthy skin, just to check out how it lives and how it feels, it's great. Cuperosis, it is a sign of the sensitive skin. It can be the sign of the sensitive skin, especially in the higher level of the sensitivity, because redness is one of the symptoms. That's how sensitivity can manifest. But as an isolated sign, we are not diagnosing the sensitive skin just because you see some cuperosis. Cuperosis can develop as a sign of the sun damage. And once it's developed, it's definitive. It's no way back. You can't just clear it with a laser treatment because it just, it's a broken capillary. You cannot eliminate it with any type of the topical approach, unfortunately. Also, it can be the sign of some mechanical trauma. It can develop after the surgery. It can develop after injections on the perfectly resilient skin. So we should see the situation more globally. But if you see a lot of cuperosis and the red skin, you can presume that the skin is sensitive. Anyway, go through sensitivity scale. Thank you very much. Happy to see that many of you love the information. In my opinion, can the skin type change in the lifetime? Having acne as a teenager, but after 30 years, pores are still big, but sebum is not producing the same. It's a great question. Yes, skin type can change at some level. But if you are born with a sebum glands less active, you will have tendency for the skin dryness for all your life. Same for the skin oiliness. It's genetic predisposition. Sensitivity can be the genetic predisposition as well. Rosacea, it's one of the skin conditions which also is genetically predisposed. Pigmentation and wrinkles development, they are more related to the external factors. So speaking about the skin typing by Dr. Bauman, your Bauman skin type can change, but your genetic skin types cannot change. So once oily, always oily. When you become older, in the age of 30, 35 plus, your sebum glands naturally become less active. So your skin will be less oily and you are in the much lower risk of the acne development. But in the menopause time, you will be in the higher risk once again, just because of your individuality. So it means then you should use a personalized skincare routine designed for the genetically oily skin, for the skin with a higher risk of the inflammation development. It's absolutely possible. Acne plus dry sensitive skin, from where to start? I will start with hydration. And this type of the information can be very much linked to the barrier, to the disturbed barrier. So once you repair barrier, it should be much better. And after, you should go once again through the assessment to see what types of acne treatment you need, if need any. Thank you very much, Elena. Very happy to know that you love the information you have from the webinar. Can this Meder product be used for vitiligo skin for the face? Honestly, I don't know. Vitiligo, it is a tricky condition, and now there are efficient dermatology treatment for vitiligo. I never see, in 17 years of the brand existence, we never see any negative aspects of vitiligo dynamics after using Meder skincare. So I presume it is safe. But I will never say that it can be used for improve vitiligo. And I still think that when, if you are thinking about the vitiligo treatment, probably it's worth to discuss it with a dermatologist, what kind of skincare it is possible to use during the specific treatment. Happy to see Oana. Thank you for joining us from your clinic in States. Thank you very much. Thanks a lot. Very happy to know that you find it useful. I hope that all professionals who participated in this webinar, you will be able to use this new information, knowledge, and more structured approach to your consultation starting today. And we will send you video of this webinar and the short guide helping you to transform your consultation and to get nearer to the perfection. Thank you so much, and I will be happy to welcome you to our next free webinar in Active Longevity course in the 14th of September. And for now, wish you the great rest of the summer. Thank you.